Right, 9 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Today is Friday, day 1 in the month of December 2023. A happy new month to you once again. I wish above all things that you prosper and be in health. And I also hope that all of your heart desires come to manifestation in this month of December. All right, my name is Blessing Agbeton. Thank you very much for joining us today on Radio Doctor. You know how we start. If you think about it, what are those things that you would say has been working for you concerning your health? I really do hope that your health has been something that you have been taking very serious, and you have been trying your very best to stay healthy and safe. All right, welcome to Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized radio health program where medical doctors consult for free and advise on your women radio. And of course, it is broadcast Mondays through to Fridays, 10 to 11 a.m. My name is Blessing Agbeton, and our radio doctor for today is Dr. Abiola Ajayi, the MD CEO of our Specialist Hospital. Good morning, Dr. Abiola. Good to have you on the show today.
Good morning. Thanks for having me.
Yes, thank you for joining us. Happy New Month to you.
Yeah, same to you. It is the first. Okay.
Yeah.
Last month of the year.
Yes,
What are you going to ask for Christmas?
This is a blank check code.
I'm not saying from me. I'm just saying from the universe. You know?
Why now? You didn't even allow me land before putting out the disclaimer. Thank you. Don't worry. I've said it deep in my heart, and it will come to pass. Thank you very much for joining the conversation today. All right, today being the first day in the month of December 2023, also happens to be the World AIDS Day. The World AIDS Day is observed every year, December 1st, to raise awareness about the AIDS pandemic caused by the spread of HIV infection. And of course, it also serves as an opportunity to show support for people living with HIV and to commemorate those who have died from AIDS-related illnesses. And in commemoration of the World AIDS Day, today on the Radio Doctor, we will be discussing, consulting and advising on HIV and AIDS testing, treatment, and care. Dr. Abiola is here to educate us on this today. You can be a part of the conversation by calling us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log on to our website www.wfm917.com. Download your mobile app, the BFM 917. Send in a text and WhatsApp message to 0703 175 6537. My name is Blessing Agbeton once again, and of course my guest or the doctor for today is Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital, and of course we're consulting and advising on HIV and AIDS testing, treatment, and care. All right, Dr. Abiola, let's start the conversation this way. As a medical practitioner that you are, what would you describe as things we need to know about HIV and AIDS?
When you talk about AIDS is the disease that HIV can cause. So just like the COVID virus can cause something called COVID pneumonia, HIV can cause something called AIDS. And AIDS stands for Acquired Immune Deficiency Syndrome. That long word means that this virus actually destroys your immune system. So at the end of the day, people really don't die from AIDS. They die from diseases associated with AIDS. For example, a cold that you and I can survive would kill somebody with AIDS. So they just say that person died of pneumonia while being infected with AIDS. But HIV is the virus. So you can have HIV before you get full-blown AIDS, and there's some criteria for that.
All right. Thank you very much for your thoughts on that one. I mean, the one you first said hits me somehow because it looks like this is the first time I'm hearing it. When you talk about the fact that AIDS doesn't kill, it is the sicknesses or the illnesses attached to AIDS that kill. Is that what you said?
That is exactly it. It destroys your immune system so much that common things that would fungus that normally wouldn't affect
Kill
anybody
someone.
can kill you. Yeah, so just tiny little infections or anything really can just take you down. Our immune system not only fights infection but also repairs our body and does so many different things that we take for granted every day.
All right. Thank you very much for that one. Let's talk about some of the common sicknesses, some of the common symptoms and signs of HIV infection that we should be aware of. So, since you said HIV gives birth to AIDS, so it means that if you don't look after the HIV, it might result or emanate into AIDS. So, what are those common signs and symptoms that would help us to know that this person has HIV infection?
Unfortunately, with a lot of with a lot of diseases, some of the symptoms. First of all, you may have no symptoms, and if you were to get infected on a Monday, you may not feel symptoms for weeks afterwards. But some of the symptoms mimic other things. For example, fever, sore throat, swollen lymph nodes in your neck or rest of your body. You can have a rash and muscle aches. Aside for the rash, muscle aches, sore throat, fever, that sounds like malaria, right? That sounds like a flu. So it's not that you can look at someone and tell, or really that you can distinguish any of these things from any other disease. Some of the other things that people with HIV or AIDS get, like mouth ulcers, a particular type of rash, and they often complain about fatigue. But when the virus has destroyed so many of your T cells, there's a number that you usually count those T cells. So we have something called T cells and B cells. I won't go too far into the immune system, but
All right.
you have T helper cells, and those cells coordinate your immune system, and those are the cells that HIV attacks. So by attacking those cells, you now can see all these other symptoms. When your CD4 count or your T helper cell count gets too low, that's what defines AIDS. And for a long time, that definition was different in Nigeria and the U.S. So, for example, people used to treat AIDS far sooner in the U.S. than in Nigeria, but I'm proud to report those things are changing.
All right. Thank you very much for your thoughts on that one. 18 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, this is Radio Doctor, Nigeria's first socialized radio health program where real doctors advise real people. It is broadcast Mondays through to Fridays, 10 a.m. to 11 a.m. My name is Blessing Agbeito, and our radio doctor for today is Dr. Abiola Ajayi. And yes, we're consulting and advising on HIV and AIDS, testing, treatment, and care in commemoration of the World AIDS Day being celebrated today, December 1st. All right, you can call us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537 or 703 175 6537. That is how you can be a part of the conversation. All right, send us your text and WhatsApp message on 0703 175 6537. Log on to our website www.wfm917.com. Download the mobile app, the BFM 917. Send in your thoughts to our social media platforms. WFM 917. That is the number to call to be a part of the conversation. All right, Dr. Abiola, why is HIV testing and early diagnosis important for individuals at risk?
With the new treatment protocols, and what I mean by that is, we're recommending that people get treated earlier and earlier. It's extremely important for testing. Why? Because the sooner you can start as soon as you get a positive test, you can start your medication, the better it is for you. When the patient is on medication for a long enough time, they actually can reduce viral load, and we'll talk about this later, but there's a way with medication that you can stay healthy and also reduce the chance of you passing it on to other people. And that can only start when you get tested, and you can only start treatment after getting tested. So that's the main reason why it's more important. It's been shown that the earlier you start treatment, the longer you live. And every day is precious. That's the one thing we can't get and we can't buy in the market is time.
All right. Thank you very much for that thoughts on that one. You said that. Okay. So let's talk about this one. While you were answering the other question, you said something about new treatment protocol. I would like you to tell us about that, and I'm also going to like you to talk about the different types of HIV tests available and how accurate they are.
Your first question was talking about really when you say new treatment protocols, really this approach to treatment. So I remember talking about T helper cells. They're like your immune cells, and they can be counted. You know, you can take a blood test and get a number. So there used to be a limit. So when your number got very low, we call that AIDS, less than 200, right? And in the U.S., they used to treat you when your T cells got to 350. And in Nigeria, they used to treat you when your T cells were less than 200. So you would have AIDS before you got treated. And I'm talking about now, this is going back maybe 13 years. Things have started changing at least that far ago. So now we start treatment immediately you have a positive test. And I don't know, one of the most famous people with HIV, Magic Johnson, was a basketball player for the Lakers. I don't know if you've ever heard of him before. He was one of the first people diagnosed, one of the first famous people in the U.S. about 1980. Oh, I'm sorry, in Nigeria about 1985. Between 1985 and 87 was our first AIDS or first HIV patient. And in the States, it was about 1970. But what they found is that some of those people started their medication immediately, did not wait to be counting T cells and all of that. And they saw that they lived much, much longer. So we've adopted that in Nigeria as well as in the States. So that's what I mean by new treatment protocols. As soon as your test is positive, we start you on one of the different medications.
All right. Thank you very much for your thoughts on that one. 07000 917 That is the number to call to be a part of the conversation. All right. So you're yet to tell us the different types of the HIV test available.
Yeah. So there are a lot of there are three main kinds of tests. One of them is called the antibody tests, and that one can be done with your blood or with saliva. And another one's called an antigen test. This is the one like we do in our hospital. I'm sure they do in all hospitals around. They take some blood. All you need is blood from like a drop of blood from a finger, and that's the same. And the third test is something called nucleic acid test, where they actually look for the virus in the blood. It takes a little bit longer, but it can also be done. And I made research. All three of these types of tests can be done in Nigeria. The good news is that all of them, besides the nucleic acid test, you get your results within 30 minutes. And, you know, for our listeners, you don't need to go in there and say, hey, I want a nucleic acid test. I want to. No, because the good news is all of them are 99.9% effective nowadays. Some of them 99.6 would be the lowest. So very, very reliable. Very, very reliable and very quick. The nucleic acid test is the one that actually looks for the virus in your blood. That one is 100%, but that result takes a few days, up to 10 days.
All right. Thank you very, very much for your thoughts on that one. I really do appreciate you. I mean, you mentioned the antibody test, the antigen test, the nucleic acid test. Now, you said something about the antibody test. You said that one has to do with, the testing through the blood and the saliva. And then the antigen test, which you said has to do with testing with the use of or through the drop of blood from the finger. So what differentiates these two, the antigen and the body? And the antibody.
Yeah, and the antibody. So an antibody is what your immune system makes in response to an antigen. An antigen is like a virus. So your immune system, when it sees something that is not you, we call it an antigen. So that could be a bacteria, a virus, or a parasite, anything. All of our normal cells have some markers on the outside saying that, hey, I'm one of you, so that your immune system recognizes it and doesn't kill that cell. So any cell that does not have that signal is called an antigen. And you hope that your immune system will mount an immune response to the antigen, right? You want your immune system to see something foreign and go and kill it. And the cells that identify the things that are foreign are called T helper cells. T for thymus. Your thymus gland is part of your immune system. And those are the cells that HIV hijacks. So HIV, the virus, hijacks your T cells and stops them from doing their work and just converts the DNA to make more HIV. So that's why this virus is terrible. It takes over your body, it takes over your immune system, kills the cells that coordinate everything, and uses them to make more copies of the virus. So the antibody test looks for those immune chemicals or those immune molecules, and the antigen test is just looking for the viral particles.
All right. Thank you very, very much for that one. I really do appreciate you. 07917 That is the number to call to be a part of the conversation. 07917 Send us a text and WhatsApp message on 0703 175 6537. 0703 175 6537. Log into a website www.thebfm917.com. Download the mobile app, the BFM 917. Send in your thoughts to our social media platforms, WFM 917. That is how you can be a part of the conversation. So if you are just joining us, this is 27 minutes past 10 from Women Radio 91.7. Nigeria's first and only radio station for women and their families. And yes, you're listening to Radio Doctor. Radio Doctor is that radio program where real doctors advise real people. Radio Doctor is Nigeria's first radio health program where doctors consult for free and advise on women radio. You can be a part of the conversation by calling us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. 0703 175 6537. Log into a website www.thebfm91.7. Download the mobile app WFM 917. Send in your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation. All right. Today on the show, my name is Blessing Agbeto, and our guest, our radio doctor for today, is Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital. And yes, we're discussing and consulting on HIV and AIDS testing, treatment and care. And of course, this is done in commemoration of the World AIDS Day. So, Dr. Abiola, we've been able to establish what we need to know about HIV and AIDS. And I like how you make it so simple. You made the explanation really simple. You talked about the disease. You addressed AIDS as a disease that is caused by HIV. And then you said it destroys the immune system. And one thing that you said that, is worthy of note is that HIV, it is not the AIDS that really kill. It is the diseases and illnesses that attacks the body when the immune system has been destroyed that eventually kills the individual. And then you talked about the common symptoms. You talked about how most of the symptoms that we talk about, cold, flu, these symptoms are also associated with HIV infection and AIDS, and it can become worse. And then you talked about other ones, common ones like mouth ulcers. You talk about fatigue. You talk about rash, a particular type of rash, and all of that. And of course, you've been also able to enlighten us about the HIV testing. I mean, you took out your time, and I love how you made it so simple, talking about the antibody, the antigen, and then the nucleic acid. And you also talked about the fact that you don't necessarily, as an individual, you don't necessarily need to go to the hospital to say, okay, I want you to carry out the nucleic acid. Just say, okay, I just want to test. I want to, just go for the test. They will do what they are supposed to do. And then you talked about the fact that the good news in it is that, within 30 minutes you have your results ready, and I think that is really nice. So, Dr. Abiola,
can I add something around there?
Yes, please.
First of all, I can't add anything to what you did. You were perfect in your recall as usual.
Thank you.
Well done.
Thank you. 07000 917 917. That is the number to call to be a part of the conversation. 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. 0703 175 6537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, WFM 917. That is how you can be a part of the conversation.
So I was just saying something interesting about the testing. So your recall was good. The if you get exposed on a Monday, it will take before you can get a positive test or it show up in your test. The best of them is that nucleic acid test I mentioned. Takes
Okay.
blood looking for the virus, and it can take anywhere from 2 to 4 weeks before it shows up as positive. And that's the earliest of the tests. Some of the others
The
tests may
nucleic
take
acid.
even longer. Yeah, the nucleic acid test is the fastest of all of them, and it's a blood test.
Okay.
But the soonest any test can show you a result is about 2 weeks, after exposure. But the good news is that within 72 hours of exposure, if you think or know you were exposed, for example, this is what medical personnel do. If we're exposed, like in surgery or from a patient, we do something called post-exposure prophylaxis, which is called PEP, or it's a combination of different medications that you take. Sometimes you take it for anywhere from 30 to 90 days. I'm sorry, 1 to 6 months, but it can keep you from getting HIV and therefore AIDS. But that has to start within the first 3 days after exposure.
First 3 days after exposure.
Yeah. So, for example, if you had a risky sexual encounter, we didn't talk about how the virus is transmitted, but I'm sure we'll talk about that later. But if you have a risky encounter, or like what would happen to me, we were doing surgery, and your finger gets stuck with a needle or an assistant bump, anything like that where it's risky, you can't go and get tested. If the test is going to show positive in 2 weeks, you only have 3 days to start the medication. So, but it's at least that's an option, and a lot of people don't know about it. So it's better not to keep quiet. If you're risky, it's better to go and meet your doctor and talk about post-exposure prophylaxis.
All right. Thank you very, very much for your thoughts on that one. 07000 917 917. That is the number to call to be a part of the conversation. 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. 0703 175 6537. That is how you can be a part of the conversation. So, Dr. Bila, let's talk about the transmission. I mean, how is it transmitted? All right. So, earlier this year, a particular post went viral. And, this person was talking about how she claimed to be a nurse. And then, she said she got infected. And then she was making Zobo. She was dropping her blood in the Zobo she was selling to people. And a lot of people got scared at that point in time, because how can you say you as a medical person you're infected and then you decided to infect other people by infusing your blood in the Zobo you're selling so that other people can also take it into the body. So let's talk about for education purposes. I know I have spoken with
I did hear the same story, unfortunately.
Exactly.
And I just cringed.
So yeah.
So
that
the
purpose,
good news is that I mentioned a type of test, which is interesting, but I mentioned a type of test where you can use your saliva, right? So, it can be detected in the saliva. But the good news is that you cannot transmit it through saliva. Technically, you can, but there's been no documented reports. It seems, even in the textbooks, it says it's the risk is unmeasurable. So that's the good news. More than likely, those people didn't get infected with HIV that drank the Zobo. So you can rest. And just like kissing somebody with HIV, we'll talk about myths later on, but some of those things come into play. So good news. If that story is true, I hope nobody got sick, and I doubt they did.
All right. So tell us how it is being transmitted.
Yeah, anybody can get HIV. Children, adults, men, women, it does not discriminate. But where the community where it was first seen, and still the fastest growing community, is the gay or bisexual community. So they call them men that sleep with other men. Obviously, that's the number one in terms of fastest growing. And when we say number one in terms of I'll use the U.S. and then I'll give you Nigerian statistics, but let's say about 35,000 new infections in the U.S. for last year. In Nigeria is about 25,000 documented new infections. About 70% of those are men that sleep with other men. So that's the most common one. The next most common one are what they call IVDUs, or I can't remember what they say in Nigeria, but intravenous drug users. So those that share needles. It's not just using the intravenous drug; it's that sharing the needle. You're passing blood back and around. They're the next highest group, and it's same for Nigeria as well. And then, oh, I'm very sorry. After men that sleep with men, it's heterosexuals. The men that sleep with women or women that sleep with men is the next largest group. I apologize. But that group is less than half of men that sleep with men. So about 70% in the US, about 60 to 70% in Nigeria, and about 30% of the new cases of are men that sleep with women or heterosexual relationships. After that is drug users or intravenous drug users that make up the last one. So the main ways. There's other ways where you have vertical transmission, which is from the mother to the child, which can happen, and then you have accidents or things that happen in the healthcare industry. We lump those in with those that have blood transfusions. A lot of people used to think it was blood transfusions that spread all of this, and that's not really the case. And it's definitely not something you get from a countertop or a toilet seat or something like that. So the main thing is through sexual contact and or sharing needles.
All right, Dr. Abiola, thank you very much for that one. You've clarified that you cannot, get it that way, but you can actually get it via sexual contact with multiple partners, sharing of needles, and all of that. So thank you very much. Let's talk about the treatment. In what ways can the treatment improve the quality of life for the patients?
Yeah, so depending on the situation those patients are in. For example, I've treated married people, women and men, with HIV, and the partner doesn't have it, right? And we caught it quick enough where they're on medication early enough that after a short amount of time, the risk of transmitting it to your kids or to your spouse or your loved ones is almost zero. So that's one of the huge benefits to the quality of life. Another thing, as the years have gone by, we've known about HIV and AIDS for at least 30 years now and been treating it actively. The treatment and how hard it is has changed. Before, people used to take anywhere from 16 to 64 tablets a day to manage HIV. And now, I have some people on 2 tablets a day. There's some children on 1 a day. And I've also started working on some of the side effects as well. So when you talk about quality of life, you don't want to have AIDS where every little cold can kill you. So you keep yourself healthy as well as protecting the health of others around you. There's nothing more important than that.
All right, just do well to call us back on the show. Protecting yourself, keeping yourself healthy, there is nothing more important than that. All right, thank you very much for your thoughts on that one, Dr. Abiola. All right, 07000 917 that is the number to call to be a part of the conversation. All right, Dr. Abiola, let's talk about, testing. Since this is part of what we're talking about today, are there any specific groups or community that should consider getting tested for HIV?
I'm coming off of recommendations, and we get our recommendations from places like the CDC, Centers for Disease Control, and from WHO. So if you're in the last year, or you should get tested yearly if you're a man that engages in sex with other men, you're an intravenous drug user, whether you've had sex with anybody that has had HIV, of course. The risk increases with multiple sexual partners. So if you're a sex worker or you engage in sex with multiple sex partners, you also should get tested at least yearly. It sounds like a no-brainer, but if you exchange sex for money, that means you are a sex worker. You should get tested. If you're sharing needles or syringes or other injection equipment, you should also get tested. And one that often people don't remember is that I typically test for HIV, especially when I'm testing for other sexually transmitted diseases. For example, I can see someone that they either give me the report or I see signs that they may have a STI or sexually transmitted infection. You test for HIV at the same time, because if they're at risk, performing risky sexual acts with other people, there's a chance that HIV could be amongst one of them. And then if you're treating hepatitis or tuberculosis, especially in third world country, we typically test for HIV. So I didn't talk about men, women, children, because to be honest, it's recommended anybody from the age of 16 to 65 get tested, especially if you meet any of these criteria. If you don't meet any of these criteria, they still recommend you get tested every so often. At least once in your lifetime. If you engage in this behavior, at least once a year.
Once in a lifetime, but if you engage in this behavior once a year.
Once a year.
All right. Thank you very much for your thoughts on the show today. Now, how can we protect ourselves from contracting HIV? What are the preventive measures you would recommend?
The number one is abstinence, right? So abstinence meaning no sexual contact. That's the best, and that's with a man or with a woman. If we go further down, only having sexual contact with barrier contraception. That's things like condoms. Put in a barrier that helps a lot. Reducing your sexual partners makes a large difference. Those are some of the main ones. Of course, if you know your sexual partner may engage in risky behavior like sharing drug needles, using drugs, and or sex work, you would want to abstain from them. If you're having sex with someone like that, barrier contraception is the way to go. Like we mentioned before, if this is somebody that you're in a relationship with, we're not saying, dump that person, but encourage that person to start medication as early as possible. When they've been on medication routinely, their chance of transmitting it to others or you transmitting it to others now becomes very close to zero.
Just keep your calls coming in, 07000 917 917. So you're saying abstinence and then using barrier contraception is very important.
Yes, very important. The most important is what we're doing, education.
Yes.
A lot of people don't know how prevalent HIV is. The prevalence in Nigeria in 2016 was almost 4%. What does that mean? That means there were about 3.5 million documented people in 2016. Now the estimate is closer to 7 million in Nigeria alone, and these are documented. Imagine how many undocumented people there are there, maybe 2 to 3 times as much. So your chance of you running into somebody or bumping into someone with HIV is a lot higher than you expect, with an incidence of about 4 to 5%.
All right. Thank you very much for being a part of the conversation today. Just before we wrap up, I would like to ask you just 2 questions more. I want to ask you, what are the stigma and the misconceptions surrounding HIV and AIDS that needs to be addressed?
There are a few. And before I answer that question, I just remembered, or I want to add that pregnant women, because I remembered our caller.
Yeah.
I called them. We test all pregnant women at the beginning of pregnancy. Like when you register, HIV is one of those tests.
Oh.
Because also, just like with the rest of us, if a pregnant woman starts her medication on time, the chance of her transmitting to others and the baby is much less. And also, if we have the testing, there's different treatment you can give the baby that can reduce the chance of that baby developing HIV. So extremely important for women to get tested, and every pregnant woman at the beginning should get tested for HIV.
All right. So let's talk about the stigma.
Yeah. One of them is, if you're around somebody, let's say you're in a bus with somebody that has HIV, you can get HIV. You can't, you can get COVID that way, right? But you cannot get HIV that way.
Okay.
And that's because of the difference in transmission.
Okay.
Remember, COVID is respiratory droplets, and that's why you can catch it in a bus. But with the sexual contact or blood-to-blood contact for HIV, that's not possible. So sweat, saliva, urine, feces, your tears, you cannot transmit HIV. That's like one of the most common ones. Another one very, very common in this area, mosquitoes. And to be honest, I had that worry until I had to research. I mean, not recently, but when I was younger. So, because mosquitoes bite someone, suck blood, and they may transmit blood around, but it's not documented, not a single case that mosquitoes can spread the virus. And there have been many studies to check. So when they've also studied that when the mosquitoes bite, they inject a numbing chemical that the mosquitoes make, but they don't inject the blood that it just took from the previous host. They don't change. They exchange blood. So that's good news for all the mosquitoes we have in this area. Another one which kind of goes along the same lines, there's oral relations or using your mouth or kissing, all of that does not pass the virus. Most of the myths are centered around how you can get it, and then some of the other ones are about how late you should get tested, which we've talked about.
All right. Thank you very much, Dr. Abiola. As we wrap up on the show this morning, what would be your advice or recommendations to individuals who may have recently tested positive for HIV?
Number one thing, if you're HIV positive, it is not a death sentence. 20 years ago, 15 years ago, once you heard that person with HIV, you looked at them, sorry, like their life is over. Your life is not over. In fact, it does not really have to change much as long as you take it seriously. Unfortunately, one of the number one reasons why people don't get tested is because they're afraid of the result, which is terrible. I know we're trying to break those barriers down, and anybody that hears this program should pass the news on to others. And of course, I will test as many people as I get calls for today. So we'll just try and spread some of the awareness. Thank you for having me on the air.
All right. Thank you very much, Dr. Abiola, for being a part of the conversation today. And thank you for the work you do for humanity. Do well to enjoy the rest of your day.
People can reach me on my socials, ROA Specialist Hospital, on all the good ones, Instagram, Facebook, and YouTube. And we can process the applications through there. Thanks a lot.
Thank you.
Have a good weekend.
Very much. You too. There you have it from Dr. Abiola Ajayi. It is not a death sentence. So if you have it, ensure you commit yourself to treatment and do well to protect yourself by all means. For consultation, you might reach out to Dr. Abiola Ajayi by calling 0913 579 5108. 0913 579 5108. Thank you very much for being a part of the conversation. Radio Doctor on Women Radio, WFM 91.7 is Nigeria's first specialized radio house program, broadcast Mondays through to Fridays, 10 a.m. Join us again on Monday for another edition of the Radio Doctor. Many thanks to the producer and the executive producer, Tomu Okewale Shunaya. My name is Blessing Agbeito. Thank you for listening. I love you. Stay healthy always.